Nobody likes you. You aren't going to succeed in school, so why even go? Why even wake up? These are the thoughts that follow Madison every day, and with little resources available to her, Madison could only turn to a few fellow classmates for help and understanding. In 2018, this group of young, incredible students decided to take their homemade signs and stand up to their school board, exclaiming, "How do you expect us to succeed in school when we don't have the mental health services we need?" 6 San Antonio area nonprofits decided to answer these students' brave call for help by forming the San Antonio Mobile Mental Wellness Collaborative. I'm going to get to that in just a bit, but first, I want to get to know a little bit more about you. So, please raise your hand if you or someone you know has suffered from a mental health challenge. Thank you. Now, please raise your hand if you or someone you know has suffered from stress or anxiety since the COVID-19 pandemic began. Yeah, notice how I have my hand raised too. That's because I've spent most of my life living with severe panic disorder and anxiety attacks. Like the kids at South San ISD, I know firsthand what it's like to be a child suffering from a mental illness and not having the adults around me fully understand my pain and experience. In fact, for 6 months of my senior year in high school, I was diagnosed with agoraphobia, which meant I was afraid to leave my house for fear of death or severe panic attacks. The adults in my life couldn't fully understand what I was going through, including healthcare professionals and including school professionals. In fact, it was because I looked, quote, unquote, normal. As much as families are well-intentioned and schools want us to graduate, we have to make sure that we are looking holistically at students and their support systems in order to see lasting change. My personal story only drives my passion to build a system not only to help children with mental health challenges, but to help their support systems as well, which is their families, the teachers, and the school district professionals. So, in 2019, as I stated, I was a part of a mental health community, I was a part of a group of mental health community organization leaders who realized that if these issues were not addressed, the rate of youth with untreated mental health challenges would only fuel the crisis that the state was experiencing. This group quickly came together to answer the South San students' cry for help. The Mobile Mental Wellness Collaborative is the first of its kind to mobilize a comprehensive portfolio of mental health services and education out of our nonprofits and into our schools, where they are so desperately needed. Each partner is a piece of the holistic puzzle to helping not only students, but again, the full school community. So you may be asking, why schools? Well, because schools are uniquely positioned to provide mental wellness to our youth and their stakeholders. They are a trusted source among families who already use schools for other social service programs. Schools are also a convening place and one that can be accessible to an entire school community. But the challenge is schools lack resources and funding. In fact, when we first went into South San ISD, there was one social worker for 9,000 students. Since then, However, the collaborative has expanded and included 4 additional school districts. Just 2 short years later, in the midst of a pandemic, our program has used trauma-informed care to serve more than 16,000 people at no cost to them through counseling, education, outreach, case management, and wraparound services. There are 3 big reasons why the collaborative has had such an impact in San Antonio. Number 1 is collaboration. This seems obvious, right? But having partners who all bring something different to the table, but the same vision for providing mental wellness to not only the children, but to their support systems. You need partners who trust in the mission and in each other. This partnership wouldn't be where it is without each partner working together on research, education, and building a sustainable structure to this program. The second one is innovation. This program works because it recognizes that there is no one-size-fits-all in mental health. We work with school districts to design a comprehensive program that fits their needs, not the needs of our individual organizations. We are meeting those needs in services and where it can be accessible to them, whether it's at a district care center, in the schools, on Zoom, or even in one of our nonprofit offices. And number 3 is participation. Everyone has to be all in with implementing this program. That means that school districts have to have a buy-in to support these services in schools, and nonprofits have to provide professionals for this program. And of course, our funders, our incredible funders who work to help us to remove barriers in healthcare. When you bring collaboration, innovation, and participation together, you end up with a program that is changing the system of mental health, a program that is breaking access barriers, transportation barriers, language barriers, and of course, stigma barriers. There are 5 nonprofits right now working within our collaborative, and some of them are here today, and I just want to say thank you. I think there is nothing we can't do together. We have worked so hard and tirelessly over the last 3 years to build a program to work for this community, and I can't thank you enough. We will be adding additional partnerships because the need has vastly increased. The collaboration has received financial support from foundations, businesses, and government entities. And we are working on plans to keeping funding a sustainable model so that the gap in resources can remain in the school districts without the school districts having to shoulder the burden of the full cost. These kids are our community's future. They might be the next scientists to discover a cancer-related technology. They might be the next doctor who uses artificial intelligence to diagnose a disease. But with the weight of the world on their shoulders, these kids need mental wellness toolkit. That includes professional counselors as well as mental health, education, and support. Please join me in making mental health as much a priority as we do our physical health and well-being. No child deserves to suffer because they or their support system do not have access to appropriate services. Providing mental health through the schools is a way to ensure that other kids have a more supportive mental wellness journey than I did. Together, you can help us change the future of mental health and wellness. May is Mental Health Awareness Month, and I cannot tell you how thankful I am that I am here tonight telling you about our innovative, transformative program. Thank you.